Good morning, Quad Cities. Got a great show for you today. We're going to be talking about the flu and flu vaccinations. And this is something that a lot of you have encountered recently. Of course, I actually went in for a Medicare physical the other day. And the first question, the window was opened. I gave them my name and they asked, would you like a flu vaccination today? And you can kind of guess what I might have said. But after the show, you'll definitely know what I said. But in any case, we're going to be covering that topic. But first of all, let's give a couple announcements. One of the announcements is this, that we have the weight loss seminar on Tuesday evening at 6:30 at the Welcome to Health Center. Very easy to find. It's on 53rd Street in Moline. Moline is, it kind of branches off of what used to be called 23rd Avenue or now Avenue of the Cities. We're kind of in the middle of the block, just off of the Avenue of the Cities there, just right across from 53rd Street. And the stores across the way, Kmart is there, and then there's the Verizon store, which is right almost across from our practice also. So you kind of know where that is. Anyway, one of the things that has occurred in the last week, several times as a matter of fact, and I just want to let you folks know that this is, if you're thinking this way, I want you to kind of like just set the goal, make it a close goal, and get in to see me and our wonderful staff at the Welcome to Health Center. Because a couple times this week already, I've gotten this from a new patient. I've been meaning to call your practice for, 3 or 4 years now. And I just, my wife and I have discussed it and everything. We meant to get in and we just haven't called. And I'm so happy now that I've called because the thoroughness of your examination and the way you approach things seems to be so good. You're definitely not just in there and feeling and popping things. You're trying to find out what's going on, what actually is wrong with me. And you're doing it on a couple levels, not only chiropractic health, but also we're doing it in terms of biochemical health, and you're looking at the nutrition involved and what my diet is and how I can improve this and that. Because I know a lot of you folks out there have serious health problems. And to some extent, a lot of doctors don't really approach your health problems with the thoroughness that you want them to. And I tell you, that's our goal at the Welcome to Health Center, is find out how we can help you be healthy. Now, that's a lot different than how we can help you cover symptoms, because a healthy body doesn't have that many symptoms. Sure, they feel pain. If you don't feel pain, by the way, you're not healthy. One of the biggest problems, we don't see it a lot in this country, but one of the problems with leprosy is that you don't feel pain. And so you shut your finger in a door and it gets infected and falls off. Something pinches your arm all night. You don't get blood to your arm all night. You don't feel the pain. So what happens? Your arm falls off, and pretty soon you've got, missing one arm. So that's leprosy is a pain problem disease. You don't feel pain. So you want to definitely feel pain. You want to be healthy enough to feel pain, but you don't want chronic pain all the time. You don't want fibromyalgia. You don't want all this stuff happening constantly. And I tell you, I don't care how long it takes to find out what it is in your body that is causing these different symptoms. We're going to look for the cause. We're not just going to try to cover the symptoms. So come into the Welcome to Health Center. Put it on the calendar. In fact, the best thing to do is right now call 309-764-2115 and leave a message on our machine. Say, call me back. That way you won't put it off until next year and the year after it. Get in there and see us. There's lots of problems out there. One of the things that we know about a large portion of the population today is their addiction to opiate drugs, on OxyContin, oxycodone, et cetera. And you know that what is being done there is rather than fixing the problem, rather than improving the function of the body, the problem is just being covered. So set yourself up so you're in contact with somebody who can help you find out what the darn problem is in the first place, and then we'll start working on a way to get you past the problem. Now, this time of year, every year I do a program on the flu. And obviously, it's very clear why. You go anywhere in the Quad Cities, you're going to have signs out by all the drugstores, et cetera. You're going to be asked multiple times by healthcare professionals, have you got your flu shot yet, et cetera, et cetera. And there's a reason for focusing on the flu this time of year. And I'm going to go a little through the physiology of the flu so you understand that first, because why do we get the flu at this point in the year and then toward the end of the cold season we also get it? So let's look at that a little bit. Well, first of all, the flu virus proliferates, or it actually replicates best in a cold environment. Now, your throat cells are exactly throat cells and to some extent sinus cells with cold virus. But your throat cells in particular for the flu are the place that the flu virus replicates. Now, I don't say reproduces or, because it's what cells do. They divide and they become, two extra cells, then 4 cells, 8 cells, et cetera. But viruses don't work that way. The flu virus, what it does, it actually gets in your throat. It gives you a false signal. It has a false key, and it unlocks your cell membrane in your throat cells, those little cells, and it goes into the cell, and it commandeers your genetics, it commandeers your reproductive capacity, and starts creating viruses. In other words, it's kind of like this. It sneaks into the factory. It gets the blueprints out, the protein blueprints out that it needs to produce viral parts. And it goes to the manufacturing machines and it starts putting out virus parts like crazy. Now, it can't do that on its own. It can only do that by actually, breaking into the factory and actually stealing the capacity to produce these things. But it's there all night long and it's producing so many viruses. And by the time the morning comes, it has produced 100,000 viruses in this one cell. And now those viruses break out of the cell. They go to the cells around it. They use their false keys. They unlock the factories. They go into the cell, commandeer their reproductive capacity, and produce more viruses. And it just keeps going like that and going like that. And by the way, it could kill you, except your body starts defending itself almost immediately. The first line of defense is the innate immune system, and it consists of these macrophages, these big eater cells they're called, and they're amoeboid cells. They crawl around, they make sure that they find these cells that might be infected. In fact, they don't even care. They just start destroying throat cells, and they're your cells that they're destroying, but they start destroying throat cells. Your throat gets all red and things, and thank goodness, because the first line of defense is slow things down. We've got to buy some time because it takes a couple days to get the central immune system involved. And meanwhile, you could, die. So it just starts ripping your throat apart with these immune cells, and it buys some time, basically. So then what happens is another kind of cell picks up parts of these ruined viruses that have been destroyed, and it carries them into the central immune system, and it tries to find a solution. It tries to find a cell that's either a memory cell, namely a cell that remembers this particular virus, or it goes and looks for cells that are close enough that they can do a little bit of genetic adaptation and match the parts so that they can start going after the viruses themselves. Okay, so that's kind of the defensive system, but a few things happen on the way. First, the flu viruses gain a foothold primarily because of the weather. When you're breathing cold air, like on certain days, like today even, where there's a chill in the air, and as you breathe that cold air in, as that cold air hits your face and your head, it cools everything down. Obviously, that's one of the reasons why it's really a great idea to wear a hat in this kind of weather, no matter whether you like hats or don't like hats or it flattens your hair or anything like that. What I always tell my patients about hats are that even if the hat flattens your hair, you still look better with flat hair than you do with your nose running, with snot running out of your nose, and your eyes all red and watery, and coughing, and choking, and sneezing, and dry throat, and all that stuff. A hat looks better than any of that stuff. So lose this stuff about I don't wear hats. Wear the hat. Keep the head warm. Put the scarf around your face, etc., even early in the season, because this is the flu season. And what's the flu looking for? The flu viruses are looking for throat cells that are cooled down lower than body temperature, because that's absolutely perfect for their replication. Okay? So wear something over your face, wear something over your mouth, wear one of those, those masks that you put over your face, to keep the fumes out and stuff. Wear that. Do that because that'll help you. Then the second thing is this. The flu virus doesn't do well in heat. Therefore, what's the second thing your body does? It sends messages to the brain that it needs to ramp up the temperature. And the temperature is very, very important because what the temperature does, what a fever does, and you can stand up to 104, even 105 for short periods. And if your body goes that high, that's because you need it to go that high. Are you going to be miserable? Absolutely miserable. But if your body needs that, don't take it down because this is what the fever does for you. It speeds up everything in your body. It speeds up, except you, by the way. You're under the covers, covered up with blankets and everything else, trying to avoid the chills, right? Which is something you want to avoid. You want to get things heated up. But it speeds up everything. Your fingernails grow faster, your hair grows faster, and even more primarily, your immune cells grow faster. And you put out these defensive cells from the central immune system. One of the reasons it can go so much faster is because the lymph fluid actually melts because of the high fever. And now you've got communication between the inside of the immune system and the outside, and it's very, very efficient. A lot of cell junctions are loosened a little bit, and you've got an army. You've got a battalion after battalion of immune cells coming in to fight the viruses and to get rid of the cells. And they're more specific. With antibodies, they lock onto the viruses and prevent them from using that fake key. You kill the cells that are trying to manufacture viruses, and very specifically, and everything is then downhill for the viruses and back, hopefully, up to health for you. So all those things are happening because you've warmed up the system and you've allowed the fever to do its job so that the immune system can fight nobly in your benefit. By the way, if you take any kind of cold medication or flu medication, you're working for the wrong side because you lower that fever or you say, oh my God, I'm just miserable. It's your job to be miserable when you have the flu. It's important to be miserable when you have the flu. If you're not miserable, you're not fighting the flu effectively. And you're going to extend the amount of time that you're miserable because you're not going to allow your immune system to do what it's designed to do. But, okay, so you're miserable, but don't take medications because any of the medications that I know of are going to actually inhibit your immune system and give the flu a new lease on life. You don't want to do that. Okay, so that's kind of our message. Drink lots of hot water is the thing that I think is probably the most effective thing that I've ever discovered. And I would go through the entire story of how I discovered it, but we've got some other things to cover first. But in any case, drink hot water, hot liquids. I prefer hot water because you can drink that all day long. And I even have a coffee cup warmer by my bed so I can have hot water at night because, you're trying to go to sleep, your throat kind of tightens up a little bit and you start coughing and then you can't go to sleep. Then you douse it with that hot water, melt all that phlegm in there, swallow it down, and warm the mucous membrane because warm mucous membranes do not produce flu viruses very effectively. And by the way, if you want a really good summary of all this stuff about flu physiology, you can get it online. You can go on YouTube and you can go to a program called Body Story. First episode, second half. Sometimes it's divided into 4 sections, so it'd be the third segment. But it's the first episode of Body Story. It's a Discovery Channel episode, and it shows this physiology just beautifully. It really, really goes into depth. So go to that. And Body Story, episode 1, second half. Okay, so now I've got an article here right in front of me called Temperature-Sensitive Influenza Virus Genome Replication Results from Low Thermal Stability of Polymerase cRNA Complexes. Now that's pretty, highfalutin research kind of talk. But what the article's about is just what we said. It's about how that at normal body temperature, the flu virus has a hard time. It doesn't really, get in there and start replicating very effectively. Temperatures above body temperature, this article says, it doesn't do well at all. In fact, at 104 degrees, all viral replication stops cold. It can't replicate anymore. On the other hand, at temperatures below body temperature, it replicates like crazy. So this is the research journal is Virology Journal. You don't get more basic than that. And that is a research article. If you would be interested in having a copy of that, by the way, for anybody who's interested, just stop by the practice and pick one up. We'll print one off for you really quickly. Another article that is very important because the flu vaccination is something that is, of course, being pushed a lot. And this article is on Medscape News at medscape.com. And medscape.com is one of the largest internet medical education sites that I've ever found. I mean, they've got articles every week. In fact, every day they've got new articles on all kinds of things. And they're written primarily in a style that is somewhat accessible. But in any case, this particular article is called Flu Vaccination for All, a critical look at the evidence. And what this article goes through is very interesting. I'm just going to read a quote because the major reason that the flu virus is being recommended is that they want to reduce the number of hospitalizations and they want to reduce the number of deaths from flu. And people do die from the flu, no question about that, and people get sick and some go to the hospital. But that's the primary reason why the flu vaccine is, advertised, given. That's the primary purpose of it, is to reduce sickness and death. But this particular article, and this is the first quote is from Tom Jefferson, of all names. Tom Jefferson, the head of vaccine field group at the Cochrane Database Collaboration. And this is, you have to understand who these people are. The Cochrane Database Collaboration is the largest evaluator of the quality of research and the amount of research. And then they do summarizations of all of the research that's available. And then they come out with a judgment as to whether there's enough research to make a claim or there's not enough research. And they are one of the most highly respected databases of research worldwide. Okay, so Tom Jefferson of that particular, the vaccine field group, says this. He voiced serious reservations about the data supporting influenza vaccine recommendations. And he stated it this way: the vast majority of studies are deeply flawed. Rubbish is not a scientific term, but I think it's the term that applies here. Now, that's a very, very strong statement. Very strong statement. And you go through the article and you go through the history of vaccination in the article. It's very interesting because we really started getting concerned about vaccinations back in the 1918 area when the Spanish flu came through, and worldwide there were millions of people that died of the Spanish flu. Our boys were just getting back from the First World War. My grandfather was one of these people that was coming back from France. And the flu swept through the entire world and wiped out large numbers of people in the United States, millions as a matter of fact. And it was a horrible pandemic. On the other hand, what happened was this. They said, we need a vaccine, because there had already been talk of smallpox vaccines and things like this. We need a vaccine. So they started working on vaccines at that particular point. What happened, however, though, was vaccine after vaccine, they saw no measurable difference between the number of people that were sick and people that died with vaccination than they found normal people in the normal population. As a matter of fact, it was kind of interesting because this Spanish flu that was swept through was one of the main reasons that chiropractic was actually licensed in about 36 states throughout the United States, because they were starting to keep statistics on these things at that point, and they found out that chiropractic patients died less often percentage-wise than the rest of the population. And so they wondered what in the world was going on. There's got to be something with this chiropractic thing. And so chiropractic was actually given state licensure in over 30 states at that particular point in around 1918 or following 1918. So that was kind of just a kind of a sideline. But the question is, how effective were the vaccinations? Well, they haven't been effective. And as a matter of fact, you come all the way to the current day, and they still have around the same effectiveness as people that don't take the vaccination. Now, there's been a lot of changes in laws, though, because they keep saying that, if you're a healthcare professional, you have to be vaccinated. If you're going to be a nurse working in a hospital, you have to be vaccinated. We don't care if you don't want to be or anything else, you've got to be vaccinated. So there have been a lot of laws and forced vaccinations, so to speak, even though there has not been any kind of proof that these vaccinations actually make a difference. As a matter of fact, let me see here. They're recommending that the elderly become vaccinated. Okay, so et cetera. Let me just read a little bit of this. The national influenza mortality rates among seniors increased in the 1980s and 1990s as the senior vaccination coverage quadrupled. So, you know, we and these kinds of statistics are all the way through this article. As a matter of fact, just in terms of my memory, a few years ago, they were talking about the swine flu and things like that. And I, of course, listen to these things very carefully when I hear them over the media. And there was a flu virus that was going to sweep the country and was going to decimate everybody. And there was an English company that messed up, and they contaminated their flu virus, and they were the major source worldwide for flu vaccination. And they messed it up. And so there was going to be a horrible shortage of flu vaccine, and they were recommending only the very old and only the very young be vaccinated because they're the most at risk. And it turned out that there was a lower mortality and morbidity rate that year, less sickness and less death that year than at any year around that year. And you kind of wonder, don't you? Of course, they were describing it as, well, gosh, thank goodness it was a weak strain of the flu. And it could have been, but thank goodness maybe they didn't have the vaccine, because that may have been what, an actually advantage. We'll talk about the disadvantages of flu vaccination with the dangerous chemicals, aluminum and mercury, et cetera, in other shows. But I want you to realize that if you're not disposed to get a flu vaccine, there is plenty of evidence. Again, this article is available to you if you want to show it to your doctor. Stop by the clinic. We'll print off a copy for you. And it's something that I think that is very, very important to be educated about. But, these flu vaccines, there's a immense value to understanding how this stuff comes down and how it is promoted, et cetera, because if you understand why these things are promoted and the groundwork of evidence that may be there or may not be there, it's something that you need to evaluate. It's not something you're going to get from the drugstores, or not even from your physician, unfortunately. They're there, they make these things available, but you've got to do your research. And this flu virus or flu vaccine for all, a critical look at the evidence, is a tremendous article for educating yourself. Give the office a call. We'll be happy to print some off for you. And meanwhile, I want you to remember that we've got the weight loss seminar on Tuesday evenings at 6:30. And stop in. Don't put it off any longer. Call the Welcome to Health Center. Get yourself in. We're dedicated to helping you. Talk to you next week. Bye-bye.